Hi, it's Graham Healy from Healy's Musculoskeletal and Healy'sLowerBackPain.com. In this video, I describe the complexities of lower back pain. It's not just lower back, it's the hamstrings, the hips, the level of your hips. There's a whole chain reaction that's involved. In this video, I explain how and why. Enjoy the video. Hi, it's Graham Healy from Healy's Lower Back Care and Healy's Musculoskeletal.com. Tonight I'm going to cover some anatomy and physiology regarding lower back pain. It's a little bit complicated, but I'll show you how dry needling can relieve the tension on the various connective muscles. Now, lower back pain is quite a complicated scenario because it involves a lot of various muscles. Now, I'll strip the muscular system off here, so we'll take all the muscular system off. We'll just start from the basics. Hello, we've got a missing leg here. So we'll just go back to home, undo. It doesn't want to bring it back on. We'll add that in. We'll add that. Yep, we've added the muscle back on. Now, the thing is, you've got your ilium, right? The crest of the ilium. Then down here is what it's called is the ischium. So ischium, ilium, that's the correct name for that, what you would term as your hip bone, right? It's broken into various sections, medically speaking. So that's the ischium here, that part there. This part here is called the pubis. This part here is called the ilium, right? Now, of course, here you've got the head of the femur. Here is the femur itself, or your thigh bone, and here is the ischial tuberosity, where a lot of muscles will hang on to. Now, when we go to here, I haven't got any nervous system or anything in here, but we'll just have a look at the third lumbar vertebrae, then we go the fourth, then we go the fifth. Now, the fourth and fifth is where people have all the issues, right? The fourth and fifth vertebrae normally. Well, they can have it up here at the second, or the first lumbar vertebrae is sitting right up there, just level with the bottom of your ribs, the floating ribs. So what affects the lower back area here? And before I go any further, this anatomy charting belongs to the Complete Anatomy. I always have a link in the video so that you can subscribe to the Complete Anatomy. Anyone who's doing any professional work, I thoroughly recommend it, and it's probably one of the best software anatomy and physiology programs in the world, I believe. So you're interested in the Complete Anatomy, please click the link that I'll have in the blog and on the website, and subscribe. It's fairly economical. If you're a student at university, I think it's only about $100 a year or something like that. If you're a professional, it's a little bit more expensive, but it's tax deduction for you anyhow. Okay, so that's Complete Anatomy. Giving that a plug. So in between the vertebrae, of course, is your intervertebral discs. Now, I haven't got them in there at the moment, and they're like rubber discs. They're not rubber, but they're like rubber discs cushioning the movement of the spine. And the spine sits in a sort of S shape. And of course, the spinal column goes from the brain right through here. And most people, when they have back pain, they can, not all the time, but they can have radiating back pain, and that radiating is basically, it feels like electrical impulses. So when it feels like an electrical impulse going down the back of your leg, this little or big nerve here called the sciatica nerve, people say I got sciatica, and they call everything sciatica, but basically sciatica is this huge nerve that emanates from the sacral area. And I'll just remove this or hide this. and you can see the roots of the sciatica nerve, which travels all the way down and joins as the tibial nerve later on, but its main trunk is sitting here behind the the anterior or the posterior sort of part of the femur there, as you can see. Right now, if you have an impingement, especially about L4, L5, the sciatica will light up. All right, very, very, very painful actually. So there's several roots, and the roots are basically locked into the area which is called the equinal area of the spine. Now we'll just see if we can put some more nervous system in there so you can see it. It all gets very complicated once we start putting all the nervous system in. So as you can see, all these other nerves here, they innervate the muscles and what have you, and I'll clear them out in a little while. But as you see, this part here, this is called the spinal dura, or the sacral area. The spinal dura mater is a tough fibrous membrane that protects and encloses the spinal cord. It arises in the foramen magnum, and we won't go into the details of that. So, okay, you see how the sciatica, the roots of the sciatica nerve blend in to the equinal area of the spine. Now let's see if we can put a little bit more, we'll go a bit of connective tissue now. So in the back of the ilium, or the hip as you would know it, this area is the ilium, pubis down here, ischial tuberosity. They're all got, medical names, but people generally will say this is their hip. It's actually the ilium, but for the sake of simplicity, we'll just call it the hip bone. Let's call it that. Now you see, there's all these very, very tough ligaments, posterior sacral ligaments all around the sacral part of the structure. We'll just put the sacrum back in there. All right, so that's the sacrum. And out of the sacrum, you have various nerves coming out of there. Now, I don't want to get complicated with this because, as you can see, it sort of becomes a mystery journey. But I'll just show you these. One moment. These are usually pretty good. We'll go back. And there is, just one moment, please. There's a really good there is a very good section here. No, I'm not going to look at that. Cross sections I don't want to see. The models we've had a look at. Peripheral nerves we've had a look at there. I will find it. Don't worry. When we have a look at this, we'll have a look at the sacral nerve again in descriptions. And what we want is, here it is. Now, I found it. This is the path. That's the isolated part of the sciatica nerve, as you can see. That's isolating it, right? Did you see there? Right, you see these, the roots of the nerve, particularly up here where it blends in with the spinal column. But this one is a good one here. I'll bring this up now, if you can see that, right? That is the path of your sciatica nerve. Now, this diagrammatic representation is really good. That's your spinal column. And this is where the sciatica nerve, with its roots, 1, 2, 3, 4, 5 roots, blends through the sacrum area. And this is around about L, 4, 5, around about that area there. Now, you can just imagine, I'll bring that up a little bit closer. You can see how you're going to have all sorts of problems once the alignment of the skeletal structure is out regarding your sciatica nerve, right? So this gives you a little bit of a clue as to how you can have all these problems, because this sciatica nerve has all these roots, and if one of those are impinged, next minute you've got what they call sciatica. So, okay, we won't go any further on that, but that particular mode in the program is really, really good. Now, I'll take off all the nervous system here. Where are we? Nervous layers. We'll take them all off. We'll get rid of all that. Now, the next most important thing is your skeletal system. Now, no, not the skeletal system, the muscular system. Now, the reason why I say that is what happens with lower back pain is the hips can be pulled downwards, and it can be sitting across like this. You know, each one of those hips, if they're either up this way, tilted, they're either tilted anteriorly, which is backwards, or posteriorly, which is backwards, or anteriorly, which is forwards. That all puts pressure on the, especially L4, L5 area. Now, if your hips aren't perfectly symmetrical, you might have one leg shorter than the other. You might have, it could be anything. You might have had a broken leg or something, and it tilts it sideways. So I don't know whether I can get this to tilt sideways. No, can't do that. But imagine, see if I draw a line across here, if that's tilted sideways, then you get impingement in the lower back. Okay, that's enough explanation there. Now, when we have a look, I just want to show you the muscles. When we do dry needling, what does dry needling do? Well, now, as you can see here, this is a multifidus. Along the rear or the anterior part of your spine are these very thick, deep muscles. This is one of the thick, there's about, I think there's about 7 or 8 various layers to this. So the multifidus muscle, its function, action extends the neck and trunk and stabilizes the vertical column. Okay, that's one. Let's add another one in here. Muscular, add. Right, now we're getting into the big kahunas here. You imagine this. You can imagine that on your whole, from your thoracics right down to the sacrum, that this huge, strong, longissimus thoracic muscle is part of the structure that keeps you upright. Now, these are tremendously strong on weightlifters, and that you can see them actually huge muscles, about 1 inch thick. Now, when we do dry needling, we do the needling around about here so that it takes the pressure, or it defibrillates this particular muscle. Now, I'll isolate it. Where are we? We'll isolate it for you. Now, you see how this controls a whole vertebral column right down to the lower lumbar area, and attaches right here on the sacrum with ligament, big strong ligaments. Okay, now let's put a little bit more muscle on there. Further still, we see, I'm not going to go into all the various, the iliocostals, the longus, longissimus thoracic, even when we go up here to where the back of the cervical spine is. You've got splendus capitis, you've got semispinalis, all this. So these layers of muscle interlocking through the ribs all the way down the spine, we can needle all the way down here. Okay, especially the area here for the lumbar region. Now, that's part of the story, but a bigger part of the story is this here. What is going to move the hips backwards and forwards and cause impingement usually is the hamstrings. Now, we'll have a look at this here. For a start, that's the long head of the biceps femoris, which is one of the hamstrings. Okay, let's isolate it. All right, now let's reduce it down. Where are we? Pull this down a little bit. There. So there's your ilium, or your hip bone as you would know it. Now, once this muscle is disproportionately pulling, it will pull the hip posteriorly. Forward is anteriorly, backwards is posteriorly, right? So any one of the actions of these huge hamstring muscles, the semitendinosus, the semimembranosus, they lie along the same route, basically. I'll isolate that. You can imagine. Bring that down so you can have a look at it. Look at it side on. If that hamstring, the semitendinosus, semimembranosus, that starts pulling, it again will pull the hip posteriorly, right? Or the ilium, as you know, it's technically known as in anatomy talk. So, and the other thing is you've got your glute medius, your glute maximus, your piriformis muscles, the hip muscles themselves, and I've done another video basically on hip pain, and that also can play a big part in lower back pain, because when you're looking at the muscular system here, this is in perfect symmetry, as you can draw a straight line right across there. Now, if that isn't in symmetry, in other words, especially the hamstrings, if the hamstrings are pulling that back, or the quadriceps, quadricep there, I'll put some more muscle on so you can see that, especially the rectus femoris, and we'll isolate that. You see the rectus femoris can pull, you see it's attached to the anterior part of the ischial, the ilium there. So it can pull that forward. So what I'm trying to say here is the balance of all these muscles, if they're disproportionately pulling in various directions, which happens, people are sitting in a seat all day or they're driving a truck all day, they're not exactly, they might be, even if you're exercising and you're walking every morning, well, you can tighten up the hamstrings. If you're riding a bicycle, you can tighten up the hamstrings. Typically, bike riders have lower back issues. And it 9 times out of 10, it's all to do with the muscles, the hamstrings, the rectus femoris or the quadricep muscles pulling in various directions to pull the hips out of alignment. So, as I say, you draw that straight line there, and then if that dips down a bit next minute, you've got an impingement going on in your lower back. Now, there's various other reasons why lower back pain occurs, including disc degeneration and all the rest of it. But more likely, even if you had disc degeneration, which everyone does as they get older, and you add all these particular groups of muscles that are pulling in the wrong direction, or they're pulling disproportionately, that it's just going to exacerbate the lower back pain. And of course, with dry needling, we can needle every single one of these muscles, and usually I take about an hour to do all this, from hip pain, and I've done that video on hip pain, but lower back has a lot to do with the hamstrings. Lower back, hamstrings, and thoracics right up to your cervical spine. But you think lower back, hamstrings, and the reason, the hamstrings, as you can see, the hamstrings pull the ilium, or as you know, the hip that pulls it backwards, and then it can pull it sideways. You could have disproportionate pulling of the glute muscles, for instance. You know, when we put the glutes in here, we'll go a bit further, put the glute muscles in here. You can imagine disproportionate pulling of the glute muscle can pull one hip over. Once you've got one hip over, and I'll take all these, I'll take these all away now. You can imagine if those muscles I've just shown you start to pull the hip in one direction like that, instead of that nice straight line, you get an angle like this, and down here is an impingement, and that travels onto the sciatica nerve and what have you. Now, dry needling, it can certainly relieve and even allow adjustments to be done a lot easier for the lower back, because when people have an injury, or, you know, just from sitting all day or whatever, it doesn't necessarily have to be a major injury, but just, you know, wrong posture, it could be contribute to that. What happens is the muscles actually clam up and they tighten around the injured area. So unless you relieve the tightening of those muscles, which are actually acting defensively. Now, you can go to I've got a chiropractic degree as well as masters in dry needling, but you can go to a chiropractor and get your back adjusted. That's great. But the thing at the end of the day, if the connective muscle tissue around that area isn't defibrillated or relaxed, the muscles have muscle memory. So they go and they attempt to pull it back into the position that the muscle remembered in the first place. So if you've had an injury and you've had that injury that's been sitting there for months, maybe even years, the first line of attack is to defibrillate those muscles. And when you've got them relaxed and stretched out, and I'll just make a comment on stretching. Stretching's good too, but if you've got an injury, sometimes that can make it worse. So the dry needling defibrillates a muscle, and then you can do, if necessary, some, adjustment if required. It makes everything a lot easier. So that's the overview for lower back pain. It's quite a complicated issue, and it connects a whole lot of muscles. It connects a whole lot of nerves that as you see with that nervous chart that I had on the screen, the nervous system is like cables everywhere, but mostly with lower back, people talk about sciatica pain, the sciatica nerve. And as you saw before, the sciatica nerve is quite a large nerve with, think about 5 roots in the lower spine going right down to the sacrum. Okay, that's Graham Healy over and out. Now, dry needling can relieve all that lower back pain, but when we do the dry needling, we go all the way down to the hamstrings, the quadriceps, and sometimes right across the hips as well, because it's all to do with how those muscles pull on the hip girdle, right? And as you can see, if you have that hip out of alignment, either anteriorly forward or posteriorly backwards, it automatically puts a shearing pressure. You imagine, I'll just bring this right up so you can see it nice and clear. I'll get rid of that there. What's that? That is connective. Didn't take all the connective off. I'll take that connective off. Now you can imagine this is your spine. And I'll just bring this around so you can see it clearly. Now, this is good when it's all nice and straight and everything's in line. In there will be intervertebral disc, right? Now you can imagine I pull this side down and this side of your spine crunches down, starts to cover this space or this space or this space. There's your sciatica. There's your hip pain or part of your hip pain, or there is your lower back pain. So, it's a very, very complex system, but you've got to start by relieving the muscles that are holding this whole skeletal system together. Okay, that's Graham Healy from healyslowerbackpain.com, Healy's musculoskeletal. I hope that gives you a little bit of a better idea on lower back pain. It is not a simple matter. It is complex as all those muscles I just showed you. So the dry needling definitely does help. If you have structural issues, well, that's another story, but, contact us and we'll have a chat to you about how we can help you. But 9 times out of 10, and that's a real factors, I can get relief for lower back pain, especially with all the connective areas, especially with the hamstrings, which will control the movement of the hips backwards and forwards, anteriorly or posteriorly. Okay, hope that all helps in our little education system. Graham Healy over and out. Have a great day.